عليكم ورحمة الله وبركاته. In this lecture regarding the fetal period, which is a period starting from the 9th to 40 weeks of development, which the longest period of pregnancy. As we know, we have zygotic period, which including the first 2 weeks, and then the embryonic period, and now we want to talk about the fetal period. The objectives of this lecture are to identify the development of the fetus from third month to birth and recognize monthly changes that occur every month starting from the third one to the delivery or the 9th month. So the fetal period, as I mentioned, starting from the beginning of the third month around the 9th week of development up to termination of pregnancy or delivery, which associated with complete development of placenta and fetal membrane, and we can call the fetus or the developing organism as a fetus. So it's called the fetal period, and the developing organism called the fetus. So we can notice that in this period, the length of the fetus increased rapidly, especially during the third, fourth, and fifth months of development, while the weight is increased rapidly during the last 2 months, during the 8th and 9th months of development. Also, the duration of pregnancy, and we call it sometimes gestation, it's a period or about 280 days or 40 weeks after last normal menstrual period, or we can calculate it as 266 days or 38 weeks after fertilization. Also, measurements of the fetus, it's strongly correlated to the gestational or age or the age of pregnancy, and we have different parameters. We called it biometrics or fetal biometrics, including different measurements. For example, we have ground rump length, or sitting length, and this measurement is starting from the highest point of the head to the lowest point of the back, and we called it ground rump length. Also, we have ground heel length. Ground heel length or standing length from the highest area of the vertex of the skull or the head to the heel of the embryo. In addition to ground rump length and ground heel length, we have other different important biometrics measurements, including head circumference, biparietal diameter, femoral length, and abdominal circumference. All these biometrics or measurements strongly related to both gestational age and fetal weight. And this measurement expressed by millimeter, sometimes centimeters, and the weight of fetus expressed in gram. Also, regarding the fetal period, in the embryonic period, as we know, the formation of organs and system. But in the fetal period, the time of maturation and rapid growth, and so cells are differentiated during the first half of the fetal period, and the normal birth occur about 3 or 38 weeks after conception or fertilization. All right, 38 weeks after conception or after fertilization, or overall 40 weeks. So we have the term premature or premature birth. Premature birth means that delivery or birth occur before the 38 weeks after conception. However, we can also get example or for some measurements of ground rump length and their age or fetal age and fetal weight. For example, if the ground rump length around 5 to 8 centimeter, that means the fetus age around 9 to 12 weeks, and the approximate weight around 10 to 45 gram. If the ground rump length around 20 to 23, that means the fetal age around 21 to 24 weeks or 6 months, and the approximate weight around 500 up to 820 gram. And finally, the maximum length approximately 35 to 36 centimeter, and the approximate fetal age around 37 to 40, and the approximate weight around 3000 up to 3400 gram. So in the fetal period, or regarding the fetal period, we have rapid change that we can call it monthly change. And this monthly change occur according to rapid growth of the fetus, and we can easily note that, for example, the size of the head comparing to the rest of the body. And as I mentioned before, the length or the size of the fetus rapidly increase during the third, fourth, and fifth months of gestation, while the weight increase rapidly around the last 2 months. And here in this figure, we can see the fetus in the third month, and we can see the size of the head comparing with the rest of the body. Near the half of ground rump length occupied by the head, and the other half by the rest of the body. During the fifth month of gestation, we can see the head size around 1/3 of the whole of the body. At birth, only 25% of the size occupied by the head, and the other 75% by the rest of the body. However, and regarding the monthly change, during the third month, we can see the change regarding the face. So The fetal face now look like human. The eyes still laterally but located in the ventral aspect of the face, and the ears reach nearly the uh, primitive side, and the lymph are lengthening accordingly with slow, or we can see the lower limb slightly shorter. Also, around the 10th week of gestation, we can see the physiological herniation of the intestine, which bulk through the umbilicus and rotate externally and return back again in the abdomen by the 11th week of gestation. However, by the end of the third month, we can notice the reflexes of the muscles, and that indicate the muscular activity and now established in the fetus. Regarding the fourth and fifth months of gestation, and we can see the fetus is also increase rapidly regarding the length, and the ground rump length around 15 centimeter. It's around half of the pregnancy now, and we can also notice that by the end of the fifth week, the weight of embryo is around 500 gram, and also we can see hair yellowish in color. It's called lanugo hair, and also we can easily recognize the fetal movement, and the mothers can recognize the quickening of the fetus easily. This figure show 18th week developing fetus connected with the placenta with the umbilical cord, and we can see the maternal side and the fetal side of the placenta. However, during the 6 months, skin of the fetus look like or looks reddish and wrinkled appearance because of lack of an underlying connective tissue. So the connective tissue, not of the just underlying the skin, not developed yet. And the fetus born during the 6 months or in the first half of the 7th month has a great difficulty to survive because of the central nervous system and respiratory system not yet well developed and not able to function. However, during the last couple months, the fetus obtained well-rounded contour as a result of deposition of subcutaneous fat, and by the end of intrauterine life, the skin covered by white fatty substance called vernix caseosa, which is composed of secretory product of sebaceous glands of the skin. When the fetus age about 28 weeks, can able to survive, although with great difficulty. However, by the end of the 9th month, we can notice that the skull has the largest circumference. The head circumference reaches the maximum size, and the important fact that with regard its passage through the birth canal, which is the largest part of the body, and the weight of the fetus around 3,000 to 400 grams, and the crown ram length around 36 centimeter, and crown heel length about 50 centimeter. Also, we can notice sexual characters well pronounced, and the testes should be in the scrotum, which migrate from the posterior abdominal wall down through the inguinal canal to reach the scrotum by the 7th month. However, we can see that the testis should be in the scrotum at birth. Regarding the time of birth, the date of birth is most accurately indicated as 266 days or 38 weeks after fertilization. An important part to know the age of the embryo and to estimate the delivery time. Nowadays, obstetricians calculate the date of birth as 280 days or 40 weeks from the first day of last menstrual bleeding, but this regarding women with regular 28-day menstrual period. And also they use the ultrasound to estimate the fetal age and the fetal weight. So as I mentioned before, with 40 weeks pregnancy, before 40 weeks we call premature for birth of the fetus before this time, and after this time we called it post mature. Also, we have to know something about the abnormal fetal growth. And the abnormal fetal growth, it's considered variability exists in the fetal length and weight, and sometimes this value do not correspond to the calculated age. So the fetus in months or weeks should the parameters that obtained from this period should be in the same line with the fetal age and fetal biometrics. However, the most factors influencing the length and weight are genetically determined, but some environmental factor can play an important role in these circumstances. So we call the abnormal fetal growth, sometimes referred as intrauterine growth retardation or intrauterine growth restriction. And this term applies to infants who are at or below the 10th percentile for the expected birth weight at given gestational age. So sometimes infant has been described as small for deaths or small for gestational age, and fetal that have malnourishment or dismature, approximately 1 in every 10 babies, which suffer from intrauterine growth retardation. And this sometimes could be a risk of neurological deficiencies or congenital malformation, hypoglycemia, hypocalcemia, meconium aspiration, and respiratory distress syndrome. And the reason of intrauterine growth retardation may be due to chromosomal abnormalities or infection or poor maternal health or maternal disease like cardiac disease, renal disease, or hypertension. And that means the mother nutritional status and socioeconomic level have an effect in fetal growth. Moreover, we have another terms, we call it prenatal diagnosis. Prenatal diagnosis, that means we make a diagnosis of the fetus before birth, or intrauterine diagnosis. Many tools can use in these circumstances. For example, we have ultrasound, which is the most mild technique for prenatal diagnosis. Also, we have amniocentesis. In amniocentesis, we use a needle to aspirate the amniotic fluid, and then we have to analyze for alpha fetoprotein, AFP. Also, the most recent technique, chorionic villus biopsy, and we take a biopsy from villi of the placenta from the fetal side. In general, all these techniques used in a diagnostic purpose, but the most used one is ultrasound, because the other techniques, including chorionic villus biopsy and amniocentesis, may be invasive techniques. However, and all of these techniques not generally used except for ultrasound. So in this table we can see the development of fetus, and the event occur in each month, starting from the 8th week, which is the end of embryonic period. We can see the eyes and ear first look human, neck region slightly first become unevident, and head nearly as large as the rest of the body, more than the half of the body. All major divisions of the brain are present. First brain wave occur in the brain stem, liver, and still large. Bone formation slightly begin, and weak muscle contraction occur. The limbs are complete now, but still the digest knot separates. So the limbs look like a web, as the finger not separated from each other, both fingers and toes. The cardiovascular system is fully functional, and the heart has been pumping blood, as we mentioned, start pumping from the 4th week of development. The approximate crown ram length around 3 cm, and the weight around 2 grams. The fetal period, which started from the 9th week, starting with the 3rd month, from 9 to 12 weeks of gestation. The head now still dominant, but the body elongate and the rest of the body length. The brain continue to enlarge. Retina and eyes are retina of the eye now present. Skin, epidermis, and dermis differentiated. The liver is still prominent. Right and left half of the palate are fusing. The walls of the hollow visceral organs gaining smooth muscles, and the blood cell formation begin in the bone marrow beside liver and spleen. The notochord now degenerate, and the bone formation is accelerating. The sex can be determined from genitals. So at this period, the genitalia start to differentiate, or we can differentiate between male and female, but with slightly difficulty according to the situation of the fetus. The approximate crown rump length at the ends of the 12th week around 9 centimeter. Regarding the 4th month, from 13 to 16 weeks, sucking motions of the lip occur. Eyes can flinch if stimulated, but still closed, not open. The body begins to outgrow the head. The limbs now longer, and so this proportionally small, and the hard part now is fused. The kidneys attain their typical structures. Most of the bone and joint cavities are parents. The approximate crown rump length at the ends of the 4th month around 14 centimeter. Regarding the 5th month, from 17 to 20 weeks, the eyelashes and eyebrows now present, and the fatty skin secrete covers the body, as I mentioned before. Also, we can see the lanugo hair cover the skin. Quickenings occur now. The mothers can feel the movements of the fetus, and the body first bends forward into the fetal position because of space restriction in the uterus, and the lips achieve their final proportion and the approximate crown rump length at the ends of the 5th month around 19 centimeters. Regarding the months, 6 and 7 months, from 21 to 30 weeks of gestation, the body size and weight substantially increase. The eyes open, fingers and fingernails and tonsil complete now. Skin wrinkles and red and fatty layer under the skin, hypodermis just starting to gain fat, and bone marrow become the only site of blood cell formation. The testes reach the scrotum by the 7th month in male. Approximate crown rump length around 28 centimeters. The last 2 months of gestation, the 8th and 9th months, from 30 to 38 weeks, the fat now accumulates in the hypodermis below the skin, and the approximate crown rump length by the end of the 38 weeks or by the end of the 9th month is around 36 centimeter, and the weight of the fetus around 2.7 to 4.1 kilogram or 2,700 to 4,100 gram. In summary, the fetal period extends from the 9th week of gestation until birth. In this period, we can notice the rapid growth of the body and maturation of organs and systems. The growth in length is particularly increasing during the 3rd, 4th, and 5th months of gestation, approximately 5 cm by month, while the weight increased rapidly during the last 2 months of gestation, around 700 gram per month. And this changes the relative slowdown in growth of the head in the 3rd month is about 1/2 of the crown rump length. By the end of the 5th month, the size of the head about 1/3, comparing the rest of the body. At birth, 1/4 of the crown heel length. During the 5th month, fetal movement clearly recognized by mother. It's called quickening of fetus. Also, the fetus covered with this small fine hair, we call it lanugo hair. If the fetus born during the 6 to 7 months, it have difficult to survive, mainly because respiratory and central nervous system has not differentiated sufficiently. In general, the length of the pregnancy for a full-term fetus considered to be 280 days or 40 weeks after the last normal menstrual period for women of regular 28 period, or we can calculate it as 266 days or 38 weeks after fertilization. Different tools can be used for prenatal screening or diagnosis, and these techniques including ultrasound, amniocentesis, and chorionic villus biopsy. And these techniques can be used for determining placental and fetal growth, congenital malformation, and chromosomal abnormalities. In general, the most mild one of these techniques is ultrasound. I hope you understand this lecture, and if you have any questions or any areas need clarification, don't hesitate to contact me only via Telegram. Thank you and good luck.